There they are again. The CPs, our computer public.
Oh.
They're at the keyboard ready to explore our insides. Watch yourself, Eve.
Oh. You know you love this job, Adam.
Well,
it's just your usual opening command jitters. Just show them what you've got on the inside, the stuff that really counts.
For those of you who are in the dark about your bodies, let's shed some light on the subject.
There you go.
Hi, we're the illustrious Adam and Eve. Perhaps you've heard of us.
Not illustrious, illustrated.
Oh.
I keep telling you, we're illustrations. You're the illustrated Adam, and I'm the illustrated Eve.
Right. And the medical illustrators who drew us want us to introduce ourselves and tell you how to view our family scrapbook. This electronic photo album is divided into 12 chapters, each representing a different anatomical system. Within each chapter, we'll show you how our systems work when our bodies are functioning normally.
As well as what can happen when things go wrong.
Just click on the name of the system on the opposite page, and then watch while we tell you the inside story.
Welcome to the inside story on the cardiovascular system. And if you come across a picture, just click on it to see an animation that'll really bring our insides to life. In some of the chapters, you'll also get to see some live-action video on topics that are related to our body systems. When you see this button, click on it, and you'll get to hear some medical advice from our family physician. If you want to take a quiz on a system, click on the quiz button at the end of the chapter. I always enjoy pushing Adam's buttons a little bit. You probably will too.
Gee, thanks a lot.
No problem. Welcome to the inside story on the cardiovascular system. We'd like to request you do a surgical scrub before proceeding with this section. The illustrators are getting ready to do some open heart animations on Adam, and we need to keep a sterile field. You'll see how Adam's heart pumps blood through his major blood vessels. You'll also watch how it keeps all the blood flowing in the proper direction with a series of one-way valves. And you'll see what causes his heart to contract in the first place. Plus, you'll see how the coronary blood vessels, the plumbing lines that supply blood and oxygen to the muscles of the heart itself, can become blocked by a blood clot and cause a heart attack, or what the doctors call a myocardial infarction. Afterwards, we'll see Adam in the doctor's office, checking to make certain he maintains the normal blood pressure that is important for his health. But before Adam goes under the illustrator's knife, he wants to tell you a bit about his cardiovascular plumbing, as well as how his blood clots when that plumbing is damaged. He'll also show you how his cardiovascular system functions in his overall strategy for getting oxygen to his tissues and for removing their metabolic waste products. To see a quick overview of the cardiovascular system, click on the picture.
Today's active and animated humans are especially conscious of maintaining a healthy cardiovascular system. While the heart, which is a powerful automatic pump, is the cardiovascular component we think of most often, the blood and the blood vessels are also vital to my health. My blood volume is a critically important 5 to 6 liters of liquid that transports oxygen and essential nutrients to all of the living cells in my body, and also carries waste products to systems that eliminate them.
Most of Adam's blood is made up of a watery, protein-laden fluid called plasma. A little less than half of his blood volume is composed of red and white blood cells and other solid elements called platelets. Platelets are important in helping Adam's blood to clot, so that he doesn't need a blood transfusion every time he cuts himself slicing a bagel. You can see how clotting worked for Adam when he got careless in the kitchen by clicking on the picture to the right.
Ouch! Oh, maybe I should have stuck with whole wheat toast. Each of my fingers has numerous small blood arteries that were waiting for the knife to attack. Today, I've selected my thumb. Here's a cut section of a small artery. The traffic going by includes red blood cells carrying oxygen, platelets, which come from white blood cell fragments, and clotting factors, which are the little yellow guys that help my blood to clot. The cut from the knife broke my intact skin, and you can see the blood cells and fluid oozing out.
Adam.
The cut also exposes the collagen fibers in my tissue, which begins the clotting process. As platelets begin to adhere to the cut edges, they release chemicals to attract even more platelets. Eventually, a platelet plug is formed, and the external bleeding stops. Inside, the clotting factors take a much more active role by creating a cascade of clotting activity. The clotting factors cause strands of blood-borne material, called fibrin, to stick together and seal the inside of the wound. Eventually, the cut blood vessel heals, and the blood clot dissolves after several days. Toast, anyone? Blood vessels, including the arteries, veins, and capillaries, are the biological plumbing through which my blood flows. To see the inside story on the path my blood takes, click on the picture. As my heart pumps, my arteries carry oxygen-rich blood, shown here in red, away from the heart and toward my body's tissues and vital organs. These include my brain, liver, kidneys, stomach, and muscles, even the heart muscle itself. At the same time, my veins carry oxygen-poor blood, shown here in blue, from my tissues back toward my heart. From there, it passes to my lungs to receive more oxygen. This cycle repeats itself when oxygen-rich blood returns to the heart from the lungs, which pumps it throughout the body. My tiniest branching arteries, called arterioles, connect to minuscule structures called capillaries. Capillaries are so numerous that you can find one near every cell in my body. Of course, you'd have to use a microscope to see them. It is in these tiny blood vessels that my red blood cells release oxygen and pick up carbon dioxide and waste products from my body's tissues. You can see this exchange in the next animation by clicking on the picture. My red blood cells are my oxygen carriers. As they travel away from the heart, they traverse smaller and smaller arteries, finally arriving at the collections of microscopic blood vessels known as capillaries. My capillaries contain a high concentration of oxygen and nutrients, while my tissues contain a lower concentration. Through a process called diffusion, these particles leave the capillaries and enter my tissues. Conversely, my body tissues contain high concentrations of carbon dioxide and metabolic waste, while my capillaries contain a lower concentration. In this case, waste products diffuse from my tissues into my capillaries and from there are carried by my venous system back toward the heart. The waste products are eventually eliminated from the bloodstream through the urinary and respiratory systems. Nutrient exchange is a continuous cycle that is critical for my survival.
The illustrators are ready to demonstrate the cardiac cycle now. So we're going to start your illusthesia. You won't feel a thing. See you in a while, Adam.
199, 98.
Ooh, Adam's out now. So we can proceed by opening his chest and showing you how his heart works. Just click on the picture to see the cardiac cycle. Here are Adam's heart and great vessels. Anatomically speaking, you can see that they look more like a California freeway system than a box of Valentine's candy. Here are the 4 chambers of his heart: the right atrium, the right ventricle, the left atrium, and the left ventricle.
The great vessels that you see include the superior and inferior vena cava, which bring blood from the body to the heart. The pulmonary artery transports blood to his lungs, while the aorta is the body's largest artery. Adam's heart pumps oxygen-rich blood out through his aorta to the rest of his body. Here we've illustrated away some of the tough fibrous coating of the heart and great vessels, so you can get a better look at Adam's heart beating. If you look carefully, you can see a series of one-way valves that keep his blood flowing in one direction. We can label those valves for you. Let's see. That's better. Just from this brief view, you can see that cardiac surgeons really have a lot of very complicated plumbing to think about. They're going to inject some green dye into Adam's superior vena cava, so we can watch it pass through his heart as it goes through the cardiac cycle. Now we can trace the actual path of Adam's blood through his heart. First, his blood enters the right atrium. A contraction of his right atrium then forces blood through his tricuspid valve and into his right ventricle. When his right ventricle contracts, the muscular force pushes blood through the pulmonary semilunar valve into his pulmonary artery. His blood then travels to his lungs, where it receives oxygen. Next, it drains out of the lungs via the pulmonary veins and travels to the left atrium. From the left atrium, the blood is forced through the bicuspid valve into the critically important left ventricle. The left ventricle is the major muscular pump that sends his blood out to his body systems. When the left ventricle contracts, it forces Adam's blood through his aortic semilunar valves and into his aorta. The aorta and its branches carry blood to all the tissues of Adam's body.
I've always wondered how my heart pumped my blood. But what makes my heart beat in the first place?
To learn what causes Adam's heart to beat, click on the picture. Let's take a closer look inside Adam's heart. The yellow objects you see on the left are not nerves. They're actually specialized cardiac muscle cells in the walls of Adam's heart. Their job is to send signals to the rest of the heart muscle and cause a contraction. Together, this group of cells is called the cardiac conduction system. The main components of the cardiac conduction system are the SA node, AV node, bundle of His, bundle branches, and Purkinje fibers. Let's follow a signal through the contraction process. The SA node starts the sequence by causing the atrial muscles to contract. That's why doctors sometimes call it the anatomical pacemaker. From there, the signal travels to the AV node, through the bundle of His, down the bundle branches, and through the Purkinje fibers, causing the ventricles to contract. The signal creates an electrical current that can be seen on a graph called an electrocardiogram, or EKG. Doctors use an EKG as a way of seeing how well the cardiac conduction system works. Any changes to the EKG could mean serious problems.
Adam's heart is so critical to his survival, yet it can be damaged by factors as commonplace as stress, lack of exercise, and poor nutritional habits. The heart is a very hard-working muscle and requires lots of oxygen. As oxygenated blood gets pumped out of Adam's left ventricle and into his aorta, its first branches, the left and right coronary arteries, enter the heart, providing it with oxygenated blood. Let's see what happens when those coronary arteries develop some animated problems by clicking on the picture. We can begin by making a classic illustrator's incision into the chest wall, exposing the lungs and pericardium, which is the fibrous covering of the heart. And now we can see the heart actually beating inside the chest cavity. There's the left coronary artery up close, and the right one as well. They supply blood to specific regions of the heart. Damage to or blockage in either of these vessels can injure the wall of the heart. If we focus in on the left coronary artery, you can see the red blood cells traveling through it. But if the inner wall of the coronary artery becomes damaged, cholesterol plaque can build up, progressively narrowing the available pathway through which blood can flow. Clotted blood attempting to traverse the blood vessel may find it tortuous and too narrow for passage, and the artery may become completely constricted or blocked off. This is a major medical event that poses great danger. The blocked artery results in a lack of oxygen or ischemia to the part of the heart muscle that the artery supplies. The result is a heart attack.
Dr. Harper, what are the symptoms of a heart attack?
The symptoms of a heart attack can vary among people. For example, in one person, a heart attack may feel like indigestion, while another person might experience severe pain, usually in the center of the chest. Patients often describe a heart attack as a squeezing, crushing pain radiating into the arm, neck, or jaw. Other symptoms may include nausea, lightheadedness, or shortness of breath.
What treatments help heart attack patients?
The best action anyone can take for a heart attack victim is to call for help as early as possible. Early treatment begins en route to the hospital by trained healthcare professionals. They will monitor the patient's heart and vital signs, provide oxygen to help them breathe, and possibly medicate them to decrease the pain. In the emergency room, the hospital staff will perform tests to see if a coronary artery is blocked due to plaque buildup. Angioplasty can often treat blocked arteries. In this procedure, surgeons insert a balloon into the blocked artery and inflate it at the blockage site. This procedure makes an opening in the artery, allowing blood to flow. In bypass surgery, surgeons remove a vein, usually from the patient's leg. Next, they sew one end to the aorta. The other end is sewn to the diseased artery on the heart beyond the blocked part. This procedure lets the blood bypass the blockage, allowing the heart to receive its needed blood. To prevent future heart attacks, all heart attack patients require a low saturated fat and low cholesterol diet, proper rest, exercise, and medication.
Let's take a look at some actual video footage of a heart that's developed severe blockage of the coronary arteries. In this surgical view, we can see the heart beating. It's surrounded by a green cloth, which is used to preserve a sterile environment. The cream-colored material covering the heart is fat. This patient has an excessive amount that was probably caused by a high-fat diet. Now we're looking at a close-up view of a coronary artery. The surgeons have opened up the artery and are pulling out a long piece of plaque, which was obstructing the flow of blood to the heart muscle. Plaque buildup in the coronary arteries usually leads to a heart attack, which is the #1 cause of death each year in the United States.
After a heart attack, medical doctors can only try to manage what sound preventive care might have avoided or delayed. But Adam is someone who watches his cardiac health with the help of his physicians. His blood pressure examination is an important component of that regimen. To see the inside story on blood pressure, click the picture. Normal blood pressure is important for proper blood flow to the body's organs and tissues. Each heartbeat forces blood to the rest of the body. blood pressure moves from high pressure near the heart to low pressure away from the heart. The force of the blood on the walls of the arteries is called blood pressure. Blood pressure depends on many factors, including the amount of blood pumped by the heart. The diameter of the arteries through which blood is pumped is also an important factor. Blood pressure is measured both as the heart contracts, which is called systole, and as it relaxes, which is called diastole. Systolic pressure is measured when the heart ventricles contract. Diastolic pressure is measured when the heart ventricles relax. A systolic blood pressure of 120 millimeters of mercury is considered right in the middle of the range of normal blood pressures, as is a diastolic pressure of 80. Stressful situations can result in a temporary increase in blood pressure.
Sir, this citation is for traveling 50 miles per hour in a 35-mile-per-hour zone and for not wearing proper footwear while driving.
If Adam had a consistent blood pressure reading of 140/90, he would be evaluated for having high blood pressure. If left untreated, high blood pressure could damage important organs, such as his brain and kidneys.
Dr. Harper, what should I do if I have high blood pressure?
First, see your doctor. If your blood pressure is around 140/100, it is considered high. You should take prescribed medication and follow up with your doctor regularly. Even if your blood pressure is just slightly elevated, you should still visit your doctor and follow their instructions. Your doctor may recommend controlling your blood pressure by losing weight, quitting smoking, exercising more, or reducing sodium in your diet.
My blood pressure exam turned out just fine, and Eve really did a great job of pulling me through these cardiac surgery illustrations. I think she deserves a big hand. The inside story is that we really care about each other's hearts. After all, when two hearts beat as one, you've got to take care of them both.
Why, thank you, Adam. That was beautiful.